Good afternoon. Yes, it's working.
Oh, okay, now we're on.
All right. So, so
I just caught something because you didn't have the mic on. The people on the phone can't hear anything, so I don't think they heard it. You might want to just recap what you just said.
Okay, my bad. Before you start, Pete, sorry. I had, I forgot to press my mic button. So I'll just repeat for people on the telephone. Present members of the commission are myself, Steve Rieger, Kim Hayes, Karen Norsworthy, and on the phone, Pat Redmond. And then announcing their presence in the room were Pete Peterson, Pat Flynn, Eric Croft, Joey Sweet, Elizabeth Olsted. And those five wanted to make a presentation, I believe, or at least wanted to be available for questioning. And staff, Claire Roth and Matt Farina are in the room. So if there's anyone else on the phone who would like to announce their presence and let us know if they want to make a presentation or not, that would be great.
Hi there, this is Austin Quinn Davidson. I'm hoping to provide public testimony.
Good enough. I will put you on the list. Thank you.
Thank you.
So with that rerun of the introductions, Pete, why don't you go first?
okay, great. Thank you. Well, I'm Pete Peterson. I finished serving my third term on the Anchorage Assembly in April of 2023. I previously served 2 terms in the state legislature from 2009 to 13. And next slide. As a member of the Anchorage Assembly, the current member health benefits are $250 biweekly stipend for Assembly members versus for a health plan for executives and non-reps that work 20 hours a week or more. They get $2,250 a month to their contribution to their health plan. Next slide, please. In our Assembly member peers, the Anchorage mayor gets full executive staff benefits. Comparing Anchorage to other cities, Juneau, the mayor and Assembly members are offered the same standard health plan and employer contributions as the employees. Legislators receive full health benefits, also are allowed to enroll in PERS, and they get a per diem added to their salary, comes in at $121,000 a year as of 2024. And legislators actually have fewer constituents than Assembly members. For example, my Assembly district in East Anchorage, I had more than twice as many constituents as 2 state Senate districts. So there's actually, and there are luckily 2 Assembly members in each district, and that was necessary because you got 55 or 57,000 constituents. Next slide, please. And Assembly members' workload, it obviously varies from a member to member, but we do have the twice a month regular meetings on Tuesdays, which as a general rule end up going till midnight most every time, as I recall. And then several work sessions every week, usually Thursdays and Fridays for sure, sometimes on Wednesdays as well. And then throw in committee meetings. And then if you answer phone calls, return phone calls, answer emails, you're up to 40 hours a week relatively soon. And then then you have the community council meetings to go to. I'll just give you an example of what a Thursday was like for me when I was on the Assembly. I had community and economic development that would start at 9 a.m. It lasted an hour and a half meeting. And then I would usually get back here to City Hall by 11, and work sessions or other committee meetings would start. And Thursdays always had a community council meeting, and depending on which community council it was, it got over at 9 or sometimes 10, or occasionally the Northeast Community Council would go later than 10 o'clock. And so it doesn't take very many days like Thursday, and you're up to more than full time. Next slide, please. And so why does this matter? Well, the assembly functions best when it's a true reflection of our community. And the addition of healthcare benefits makes the job more accessible to a wider range of people. For example, when I was term limited for my last term, I was contacted by a lady who had been a member of the Russ and Jack Community Council for many, many years and had served in all the leadership roles, had a great background, and would have made a great assembly member, in my opinion. And she had called me to tell me that she wasn't going to be able to run because she would lose her health benefits. And she had 3 children, and so she definitely needed those benefits for her kids. And so it was understandable from my point of view that it was the correct decision for her, but I didn't think it was a good decision for the community. People with experience like that, are assets to our community that should be encouraged to run for the assembly. Next slide, please. And what are some of the effects? Well, there could be high turnover. Some members run and they're told that being an assembly member is a part-time job. And I was actually told that 10 years ago myself or so, when they were trying to convince me to file to run for assembly, that it was a part-time job. And it didn't take me long to realize, once I'd been elected, that it was actually not a part-time job. It was actually, if you actually did the work, it was more than a full-time job. And so now there are times when some members will just serve 1 term or 2 terms, or maybe not even finish their first term, because they realize that it really cuts into their time available to work their other job, especially if they might be a small business owner, and it starts to affect their small business because of the amount of hours they are necessary for them to do the assembly job. And so some of the members currently have to depend on a spouse or other full-time appointment to get the health benefits they need for themselves and their family. Next slide, please. What are the costs? Currently, the 250 biweekly stipend comes up to $6,500 a year. And so the total cost is $78,000 for the assembly members. The proposed $2,250 a month would be $27,000 a year per member, or a total of $324,000 a year. And the difference would be $246,000 increase over what currently is in the budget for health insurance for assembly members. Next slide, please. And so, yeah, I was surprised that when I was first elected, I went up to HR to sign up for health insurance. I was 63 years old at the time. And after filling out some paperwork, I was told that all of my take-home pay plus a couple $100 a month would be needed to acquire a health insurance for the municipality. And I was pretty surprised, because I had been working in the legislature a year or so prior to that, and I had full coverage working for the legislature. So since I was under 65 at the time and was not eligible to file for Medicare, but I was required to have health insurance, so I had to sign up for the federal plan, Obamacare, and the municipal salary was so low at the time that I was required to get a subsidy in my health insurance coverage, and I was pretty embarrassed about that, to tell you the truth, and because I'd been working my entire life and was able to cover my own bills myself up until that point in time. Anywhere, next slide, please. And so that is the presentation I have. I'd be happy to answer any questions you might have for me. Thank you.
Thank you, Pete. Questions? Yeah. Karen.
Can you tell me what you consider to fall under benefits? What do you consider is under that umbrella?
Benefits, well, that would be health insurance, the PERS retirement. We are allowed to take, I think it's 7%, I believe, out of our salary and put that towards PERS here in Anchorage. And I actually did do that. Other benefits, well, the $250 biweekly stipend for health care, that was a benefit. I believe that's it for benefits.
So just confirm what you are asking for, looking for is health benefits and PERS retirement.
Well, the PERS is already available if they're interested in that, and but the healthcare is currently, it's just a stipend right now.
Thank you.
You're welcome.
Other questions? Yes, Kim.
Thank you, Pete, for the presentation today. On this slide that you talked about the current price versus the proposed price, that would be if every single assembly member wanted that plan, which is, I would assume, optional?
That's correct. Some members typically have a spouse or a full-time job where they have coverage, and so their Anchorage coverage might just be supplemental to what they already have, and so the $246,000 would be actually the maximum amount of an increase.
Other questions? Before we move on, I have a question for Matt. Do we have a hard stop at 2:30, or can we extend? Just want to know how much I need to push things along.
The room is available, and then I think committees can extend or boards and commissions.
Yeah, it's a work session, but they're allowed to do 15
Well, the exact rules, but I've seen
minutes.
Okay, good. Okay, so thank you, Peter. Are there no other questions? I think I'll call on Austin next.
Quick
Kim?
question, Steve, will we get a copy of the presentation? Karen and I were
Pete,
wondering
can
if we
you
get a copy.
can you get a hard copy to? Oh, you haven't. Okay. Oh, emails fine for me. Oh, okay. We'll take a hard copy. Okay. Okay. Austin, would you like to go next?
Sure, I'd be happy to.
Sure.
Can everyone in the room turn their mics off so I don't get an echo? Thank you. My name is Austin Quinn Davidson, and I served on the Assembly representing West Anchorage with Eric Cross, who I understand to be in the room as well, from 2018 to 2023, and as mayor from October 20 through June of 2021, during, as you know, some of our city's darkest times. And I'm here to ask that the commission make Assembly members eligible for paid health care for a few reasons. First, the Assembly has really changed, starting off as a part-time, less engaged body, and over the course of the past 6 or so years, becoming a robust group of diverse individuals who universally work more than 40 hours a week. When I started on the Assembly, I was able to balance the workload with my other nearly full-time job. But within a year of being on the body, so by 2019, that was no longer possible, and I had to leave that job to continue to serve my city. This is a similar trajectory for multiple other members I served with, including Senator Forrest Dunbar, Assemblymember Felix Rivera, and our now Mayor Suzanne LaFrance, all of whom left other jobs to dedicate themselves completely to their service to Anchorage. Despite demanding high levels of professionalism for the full-time assembly role, the pay is quite low, now $60,000 per year, and only a few years ago it was an abysmal $28,000 per year. How can we expect assembly members to pay for their own health insurance on top of providing this low salary? Second, we want the assembly, as Pete said, to look like our community, and this won't happen if assembly members don't have access to paid health insurance. During the past decade, I've watched the assembly transition from a group of predominantly older or even retired, mostly white folks, to a body that is now more representative of our community, but we still have a ways to go. The truth is that you aren't going to get diverse representation if the only people who can afford to run for assembly are those who have wealthy spouses or spouses who have health insurance for the family, leaving them able to work in this role despite the low pay and lack of good benefits. Third, as Pete also described, the benefits that assembly members get are really out of step with other elected leaders. Members of the state house, who represent about a third of the constituents that assembly members do, work half as much. Keep in mind, they're only in session for about a quarter, well, a fourth, it depends, maybe a third of the year, depending. Yet they make twice the salary of assembly members and have health and other benefits, and they have full-time individual staff. The assembly role gets harder and harder to recruit for, and I know, because as Pete mentioned, many of us have tried to recruit assembly members to take over after we leave. And in the end, if we carry on like this, as a city, we will get what we pay for. Finally, it's the right thing to do. Right now, muni employees who work 20 or more hours a week get paid muni health insurance. How does it make any sense to provide this benefit for muni employees, yet not for assembly members who are also working hard to better our city? Why does the mayor or her chief of staff or muni manager or any other employee get health insurance, but her peers on the assembly do not? It just makes no sense. Thank you for considering this common sense and long overdue change. I'm available for questions if there are any.
Thank you. Thank you. Are there questions from commission members? Seeing none, let's keep going. I'll call on Pat next.
Thank you, Mr. Chairman and members of the commission. I actually want to start as a former Salaries and Emoluments Commission member who probably put you in part of the predicament you face today. I served in the early aughts, and at that time, the salaries had not been adjusted for school board members or assembly members in something like 8 years. It had been an extended period. And we're asked to address that, and we're asked to address health benefits, because then it now is an issue. At the time, they had no health benefit whatsoever. So we put together a series of cost scenarios, similar to what you see here displayed by Pete's presentation. And different members had different opinions on what they felt the community could afford. And we settled on a $200 per month healthcare stipend. So that's the basis of where you are today with the $250 biweekly stipend. It's obviously grown over time. It's a tough decision, right? No, spending money by the government is always should be kept in check as best possible, and spending money on elected officials is harder still, right? And yet, at the time we provided that stipend, health insurance was more affordable. I did, as an assembly member, take advantage of the opportunity to buy healthcare insurance when I was laid off from my position at the railroad in 2009, I believe. It was only for a few months until open enrollment allowed my children and I to enroll in my wife's plan. I believe John Weddleton used the municipal insurance plan out of pocket. And in both cases, we were able to do so without spending our entire assembly paycheck, which isn't very big to start with. Cost has gone up. And furthermore, there's now a federal requirement that you carry healthcare insurance. So the dynamic has changed. I can't tell you how to do this, make this decision. I can't tell you what decision to make. I can tell you we looked at a lot of different scenarios. I think it's great that the benefits manager from the municipality is here because I'm aware of at least one instance outside the assembly where a department head looked at the encumbered cost associated with the position, and because the candidate he wanted didn't need healthcare as a retired military member, he bumped her salary by the amount of healthcare she didn't take. I would caution you to ensure that doesn't happen here. I believe it was caught and put to rest, but we want to make sure that we're spending the public's dollars wisely and fairly. So with that, I'm happy to answer any questions and accept or offer further apologies for putting you in this predicament. And thank you for your service, by the way. It's a tough job.
Thank you. Are there questions from commission members? Yes, Kim.
Hi, Pat. You said at the beginning that you were on the commission when the $250 biweekly stipend was established. What year would that have been around? Before 08? Is that?
Oh yeah, it was like, I think it was $200 a month, or maybe it was $200 every 2 weeks. I forget. And it was in the early aughts.
Okay.
So
Just for context. Thank you.
yeah.
Other questions?
Yeah, if you want to make
Okay.
Pat's life miserable, you can make him dig those records up. He can find it. Thanks for your time.
Yeah. Thank you, Pat. Eric?
Thank you, Eric Crofton. Yeah, I've served in the House before they got a raise, and the Assembly before they got a raise, the school board before they got a raise. My wife likes to joke that what is it about me leaving the position that has them reevaluating salaries? But most of the good points have been made by Pete, by Austin, by Pat. So I'll try and just hit some other things. Pete referred more nicely, but to the longstanding and proud tradition of lying to people to get them to run for the assembly, of dramatically understating the amount of time that it takes. And because you want to convince these good people to run, and they're asking you how much time does it take, and you can either be honest and say, yeah, it pays this. And if you do it right, if you really are engaged in all the things you need to be, the committees that you need to be, you're prepared for the meetings, it's a full-time job. But we can't tell them that, or they wouldn't run for the thing. So, yeah, it's a tradition that we've passed on. I lied to get Austin in. I don't know whether Austin lied to anybody. She's not that type. But anyway, you have. It is really difficult, as most of us know, to convince people to run for this job if you're very truthful about the facts. And there's been a lot of different arguments, all good ones, I think, or a lot of them very good ones. Some of them seem to say it's fair. It's fair for the assembly members, or look at assembly members and do it because it's the right thing to do for them. But that's not how we usually look at a benefits package as employers, which we all kind of are, owners of the municipality, if you will. You look at a benefits package from the other end, right, from the employer end, and say, why do I have this? What am I accomplishing with it as an employer? Employers, maybe some of them because they're just nice people, but most have employment benefits package because they want to get good people to run their businesses, and they can't do it without it. It's a mixture, at least, maybe of good intentions, but also pure business. They would do it if they didn't care, so they could get the level of people they want to run their private business, their nonprofit, or the city. And I urge you to do it for that reason as well. You want people who can commit the time, who look like the community, but can commit the time and have the skills to be able to run what is a big, complex organization. We need to do our jobs to help the mayor, also serve as the check on a mayor at various times. It was built that way. And you need functional, bright, people who can dedicate the time. So don't do it just because it's the right thing to do for the employee perspective, if you will. Do it for all the reasons that smart employers have appropriate benefits package so they get the people they need to do the job. Thanks.
Great, thank you, Eric. Are there questions from commission members? Yes, Karen.
Can you tell me what you consider to be the benefits package?
Well, yeah, I think the salary we know, and then the benefits package is currently eligibility and PERS, which I did. Again, it's at a moderate salary level, so it doesn't get you a tremendous retirement, but it's something. And then right now, a $250 every 2 week stipend, and we're urging you to make it PERS participation plus actual health coverage.
Other questions? Go
Thank
ahead.
you.
Are there other questions? Okay, thank you, Eric. Joey?
Good afternoon, everyone. My name is Joey Sweet. I represented East Anchorage from January 6th, 2023 through April 25th, 2023. And I would just sort of echo a lot of the points that have already been made, particularly in terms of candidate recruitment. I tried after my tenure on the assembly to sort of talk to people who I thought would be good candidates someday in the future. And when we get up to the point where we get into the nitty gritty, not just talking about campaigns or things like that, but actually talking about the function of the job, the conversation does have a tendency to sort of stop or at least slow down when we get into, yes, you're going to work a lot and you're not going to get the same kind of benefits, even as a regular member of the municipal workforce. A month or so after my term ended, I got a position at the health department, the Anchorage Health Department, and the pay was better and the healthcare coverage was better. It was comparable, both allowed access to a great service called Vera Whole Health that municipal employees and assembly members have access to. And that was I'm not trying to sound all doom and gloom. That access is fantastic, but it does make it very difficult. And to the points that have been made, the assembly does suffer as an institution when we're not able to get, because I was primarily trying to talk to candidates who were a bit on the younger side, with the idea being that we can recruit the next Pete Petersons, the people who can be here for 3 full terms or 9 years, because as an institution, that's what you want. Those are going to be the people who end up being leaders, who end up building up that institutional knowledge that every organization needs, right? The assembly is still a workforce by itself too, and you want to try and build up longer term employees, right? So that was my experience. I hope that we're able to come to some kind of conclusion, be it this plan or some other sort of triangulation, but it is something that is desperately needed. So thank you all.
Thank you. Questions? Yes, Karen.
Yeah, I'd just like to clarify, did you say assembly members can use Vera Health Services?
I didn't make use of it when I used that service when I was part of the AHD workforce, but my memory from the HR presentation that I went through as an assembly member was that we did get access to it. I didn't make use of it, so I may be misremembering, but I do believe that they did get access to it.
Thank you.
Other questions? Okay, well, thank you. Thank you. I have a couple of questions for Elizabeth. Sorry to call you up.
Good afternoon. My name is Elizabeth Volstead. I'm the Director of Employee Benefits for the municipality.
So one, maybe to start with, is the number that was on Pete's presentation. Is it one number? what does that number represent? The 2250 that is in that, is that like an average of employee only or employee plus dependents? Where does that come from?
So the municipality makes a contribution towards our employees' premiums for their health insurance. Our health insurance includes medical, dental, vision, and pharmacy. The $2,250 a month represents the current municipal contribution for our non-represented and executive employees. Each year, when we do our renewal, which is when our healthcare, when our TPA, our third-party administrator, comes back with our costs, we adjust the municipal contribution. So that typically is adjusted based off of the previous year's CPIU or a maximum of 10%. So this is not a static dollar amount. This is specific to non-rep and execs, and it will change year over year.
And just to make sure I understand what you said, so there's a maximum of 10% per year, but what your third-party administrator does is take the overall cost of health insurance and calculate what that differential is from the prior year, and that becomes the percentage that 2250 would increase?
So when we're talking about premiums and costs for insurance, premiums are only a portion of the costs of insurance. The other aspect of that are the actual claims. And so what our third-party administrator does is they take a look at our claims expenditures over the course of the year, and they determine what our costs, they project forward, and they go backwards 2 years and project forward to determine what our overall costs will be so that we have sufficient funds to pay the claims for our employees and their dependents who are on our health plans.
So, I have more questions, but I don't want to monopolize this. So is there any insurance component, or is it really just the claims?
So the municipality's health insurance plan is a self-insured plan. And I think
Right.
that's very important to realize what that means. A self-insured plan means that we're actually paying for the claims of our employees and their dependents who are enrolled on and utilizing the plan. Claims vary from year to year. You can have a single premature baby that will cost upwards of $1 million worth of claims. So we can't cap or we can't say that there's a flat rate for claims because we never know what those are going to be. So we have premiums that go into our 603 fund that we use to pay those claims. And those are based off of previous claims experience and projected claims experience.
Okay, so what you're calling premiums is
The cost to be enrolled
it's-
in the health plan.
it's the cost. So it's like a proxy for what a premium would be, because it's a payment into this pool.
It's a payment
Okay.
into the 603 to ultimately be used for claims that are submitted on behalf of the participants of the plan.
I think I got it. Okay.
And it's not
But-
individualized. For instance, car insurance, you pay premiums and that's for you. And if you get in an accident, your insurance pays. This goes into our 603 fund and it's used to pay for all of the claims for the entire population.
So is the 2250 that's like on that slide, is that the current amount that's being paid in? Is that
That is
equal
the
to that?
budgeted amount that is
Okay.
being submitted on behalf of our executives and non-reps. So I can give you a rate sheet so that you can get an idea of what this actually looks like for all of our bargaining units. Okay? Would you like me to
Okay.
pass that out?
Sure.
Okay.
Again, please just raise your hand if you want to step in, because I'm still trying to just understand this, but I don't want to monopolize it. But if you are an employee who is single and there's another employee, or you're an employee with a family, spouse and dependents, does the muni pay the same $2,250 in either case?
Yes, the municipality's plan is a composite plan. We do not do tiering, which means we do not charge additional for dependents on the plan. So what you're looking at, and I'll draw your attention to the section on the rate sheet that indicates non-rep and execs. We have 4 different plans, though it's important to be clear that our plans are identical. There's no benefit difference. It is strictly based off of premiums and deductibles that make a difference in the plan. We have our 500 plan, our copay 1,000 plan, and then our high deductible health plans. You're going to see the full monthly premium. This is the cost to be enrolled in that plan. Then you will see the municipal contribution. This is how much the MOA has budgeted for each employee who is participating in the plan. The difference under the employee monthly share is how much also has to pay into the plan. So to circle back to your question, is $2,250 strictly the cost? No, there are additional costs depending upon which plan the employee elects.
You just explained what the opt-out line means?
So for those employees who have health coverage elsewhere and can provide us with proof of other insurance, they have the opportunity to opt out. The municipality will pay them an opt-out incentive of $350 a month.
Okay, thank you. Are there other questions? Yeah, Kim.
Hi, I have one question on the same thread and then a new thread. Do you know roughly how many municipal employees, like percent-wise, choose to opt out because they have other healthcare? Is it like 20%, 30%?
No, our opt-out, I'm really sorry, I can definitely get the exact number, but I'm going to say that our opt-outs at this point in time are probably around 300 employees. And it's very important to know that when I speak to the municipal health plan, it is only for certain bargaining units. Not all MOA employees belong on our plan. We have other employees that belong to the health trusts within that their bargaining units contract with. So Kim, would you like me to find out the exact number of opt-outs?
That's not necessary. I did if it was something you had. But I do have a follow-up question related to a different public testifier. Can you verify whether or not elected officials for the assembly have access to Vera?
So elected officials who have elected the health plan do have access to the Vera Whole Healthcare Centers.
And of those that have the ability to access, do you know the percentage that do access?
No, because Vera is HIPAA compliant, and so they do not share with us who is accessing the care center. Our employees, though, do receive an incentive for using the care center. So, at times we can kind of get an idea of the number of employees, but that's because they are incentivized to use the care center. But assembly members are not entitled to the incentive, but they are entitled to access the care center. Unless they themselves were to tell me, I use the Vera Care Center, I love it, I'm not going to know.
Follow up on that, just to clarify. So assembly members who choose, how are they accessing it? They're paying out of pocket to access the same healthcare that the non-reps and execs get?
So the assembly members receive the stipend. The stipend is added as income to their paycheck. If they choose to elect health insurance, that is pre-tax deduction, and the stipend offsets their costs. I also have the breakdown of what those assembly costs are, what their plan costs would be. So I'll pass that out as well. Is it covering their full cost? No, it is not. But it is offsetting it. If they choose not to elect our health plan, then that stipend is paid to them as taxable income. Now, they do have some other benefits that they can elect. In addition to health insurance, they also have the opportunity to elect voluntary life insurance or dependent life insurance. And That actually is it. So, so again, if they have that stipend and they elect voluntary life insurance or dependent life insurance, that would offset that cost, though that is a post-tax deduction. So I'm going to pass this out for you guys as well.
Chair Rager, I think we need to extend. I don't know how you want to do that.
Is given that this is a work session, Matt, is the procedure for extending the same as if it were a regular meeting where we actually vote to extend, or do we just announce that we're going to extend?
You can announce that you're going to extend it, just 'cause this is a work session, you can actually vote on it.
Okay. I think we're pretty close to wrapping up, so would 15 minutes probably be a reasonable announcement? Okay.
Sure, for now, unless
For now, let's
we
extend.
get into something interesting.
Let's extend for 15 minutes. We can revisit it if we're still going with that. Okay. I've got one more. I guess I'm changing tracks again, but I'm just curious. How is the Muni exempt from the Affordable Care Act? I mean, how do their provisions affect what you do?
The municipality is not exempt from the Affordable Care Act.
So does that mean the minimum plan benefits that are prescribed are part of?
We do have to meet the minimum plan set design, and our plans far exceed that.
Okay. Okay. So how do, I don't want to get too much in the weeds because I'm not sure what I'm asking here, but
Okay.
if the 250 did not cover the ACA minimum, how does that work?
By definition, the assembly members are not considered employees on our plan. So minimum essential coverage is the plan level. And because we have a plan, our high deductible health plan that costs our employees nothing, we meet our minimum essential coverage.
Okay, thanks. Karen.
Can you tell me, of the assembly members that are receiving the $250 benefit stipend, how many of them are using the benefits here? I know you can't tell me, Vera, but
I currently have one assembly member currently enrolled.
thank you.
Just to follow up, I'm about out of questions.
No, you're
But the high deductible plan that you mentioned, how does that fit in with all of this?
So not sure.
So I'm curious, is there a high deductible health plan that's part of the benefits package that's separate from the 200, what the 250 is eligible to be used for?
When we have an assembly member who is enrolling in the plan, they are offered all of our plan. Well, they are offered our 500 plan, our copay 1,000 plan, and our high deductible health plan. We do not provide them with an FSA or an HSA. Our employees do receive an FSA or an HSA contribution, but the assembly members are given the option to go into the high deductible health plan, the copay 1,000, or the 500.
Is the high deductible one of the, that's not on this sheet that you had?
It is. It's called QHDHP with FSA and
Okay.
QHDHP with HSA.
So is even the high deductible plan costing the $2,250?
So the high deductible health plan for our non-rep employees costs less than the municipal contribution of $2,250. So our employees who elect to be in the high deductible health plan receive a contribution from the municipality towards their flexible spending account or their health savings account, depending upon which one they choose to enroll in. So those employees who select our high deductible health plan are not paying a premium because the plan they've chosen is less than the municipal contribution.
So, okay, so it adds up to 2250, but it's part to that and part to the HSA.
Correct. It is a lot to absorb.
Can you tell me, for each of the plans, if I was an assembly member getting my 250, what would I be paying for each of those plans?
So on the back of the assembly document that I handed out, if you were on the 500 plan on a monthly basis, an assembly member would be paying $2,471. On the copay 1000 plan, they would be paying $2,417. And on the high deductible health plan, they would be paying $2,100 a month. One thing I do want to add is just regarding the stipend. So right now it is a stipend. Should they use it towards health insurance, it offsets these costs. If they don't elect health insurance, but they elect voluntary life insurance or dependent life, it offsets those costs. They also have the opportunity to participate in our voluntary retirement programs. So it could be considered a deferral to a voluntary retirement program. But if they make no additional elections, it's paid to them as taxable income. So any increase, if it is still paid as a stipend, would be paid to them as taxable income. Whereas for our MOA employees, if they don't elect insurance, they get that flat rate opt-out, and we're not paying them an additional $2,250 a month in the case of non-rep and execs. So it's important to know that the municipal contribution does not get paid to our employees if they don't elect. We set a cap on that.
One last question. On the back page, what you just referred us to, is that difference, the third column says employee cost per month, is the $317 difference between the first two plans and the high deductible plan reflective of the claims, actuarial difference in claims cost?
So one thing to remember is that depending upon what the claims are coming in at, the employee who is in the 500 plan assumes a much lesser risk, so to speak, than an employee who's in a high deductible health plan. And so the employees who are on the 500 plan, they're only having to come up with a $500 deductible each plan year. So then the municipality is on the hook for their claims much sooner than somebody who's on a high deductible health plan. So as a result of that, the number of employees and their dependents who are enrolled in it and the actual claims, that plan runs higher. There's a higher cost for those employees who are in that plan because of the nature of the plan.
No, I follow that.
Yeah.
I guess I would have expected the differential to be higher than just between 2471 and 2100, but I guess you're saying, no, that's what it works out to.
For the calculations that we had for 2024, that is what it works out to.
Karen.
So hypothetically, if we were to move from a stipend to benefits, coverage that we have with the employees, what is the process that we have to go through? So I think you're getting ready to go out for a new provider, new TPO, and just walk us through the process of what have to happen.
Absolutely. So right now, because our assembly members are allowed on the plan, we would not have to have an additional writer to add them because we do have the opportunity to have assembly members on our plan right now. Our third-party administrator contract is not up for a couple more years, so we're okay with that. The thing that is more important, though, is the build-out to SAP. So SAP would have to be built out to accommodate a contribution versus a stipend. Currently, they are set up for a stipend, and as I mentioned before, the excess money becomes taxable income. To set up a contribution for assembly members, we would have to have configuration done in SAP. And SAP is getting ready to, as of October, we're kind of locking everything down because we are rolling out a new version of SAP in 25 and 26.
Since, well, I won't go there because I know a little bit more than I probably should on SAP, or that I wish I did. Okay, so basically the plan is a major issue. SAP obviously is going to be a little bit of an issue. So then the next piece is, where does the money come from? So
My understanding is the money currently comes from the budget of the assembly. So the assembly budget would be responsible for the increased amount. But
yeah, and does the assembly have money in the budget sitting around for this?
Ona Brous, Acting Director of the Office of Management and Budget. Does the Assembly have that amount of money available in their existing budget? No, I think it would have to be reconfigured or an additional amount into the Assembly budget. OMB has been looking at this specifically because we are starting the budget build or in the middle of budget build, and the medical rates are being confirmed for next year. So we have done some preliminary research in other jurisdictional practices in the lower 48 for elected officials. It's not limited to just Alaska. And I think you won't be surprised to hear that many locations support their elected officials with healthcare insurance, but everybody does it differently. So some of them pay into the program that's available for part-time employees. Some of them pay in via the programs that are similar to ours. Some of them are on very restricted plans, and we've compiled some of that information, and I have some scenarios that I can give to the commission in order to sort of answer a lot of the questions that you have about what does it look like if this is the situation, how much is the dollar impact on, all 12 members joining, at what rates, and all of that would be determined based on how the actual enrollment goes for the membership. But we can make ballpark estimates, and I would say that former Representative Assemblymember Peterson's numbers are pretty close to how that cost would break down within the Assembly budget.
Thank you.
Kim?
I'm glad to hear you guys have been doing research in the lower 48. On Pete's presentation, he talked about how the city and borough of Juneau does offer healthcare to their elected officials. Do you have information? I know that that's not your purview, but are they self-insured as a borough? Do they participate in another plan? Does anybody know that?
I don't know the answer to that, but maybe Ms. Volstead does.
I don't know the answer to that either.
Okay, are there other questions? If not, I think, what's that? Yeah, I'm cognizant of the time. We've extended, I think we still have a few minutes. Before we wrap up, I want to ask if anyone has joined the meeting that we weren't aware of that wishes to make a presentation or testify. Hearing none, I'll assume that everybody who has had their hand up has had a chance.
Okay, Steve, this is Pat. This is Pat. Can you hear me?
Yeah. Hi, Pat. I can hear
I
you.
just
Go ahead.
Okay. I just wanted to make sure that if I can get copies of these presentations by email, or the general part. I've taken a lot of notes, but there's if I can get a copy of the different handouts that might have been by email.
Pat, Matt is nodding his head yes that he will get them to you. There were two pieces of paper handed out,
Right.
plus the hard copy that was promised of Pete's presentation.
Right. Okay, that's
Okay.
fine. Thank you.
Sure. Oh, yeah, boy, I pressed the button to turn myself on and I pressed it once too often. Now I'm on. If there's any additional comments from commission members, now's the time.
I just want to say thank you to everybody that came and provided this information because it's a complicated topic, not one I'm very familiar with, and I appreciate your information. Thank you for the handouts.
Yeah, thank you to everybody who testified and staff who answered all our questions. So I think with that,
Steve,
just
what are our next
Wait,
steps?
Yeah.
Go ahead, Pat.
Where do we go next?
Well, we have in the offing a meeting to talk about the school board. It hasn't been scheduled yet. We still have to do a poll to find out when members can make it. So I would think that at that time, Matt, you can correct me if I'm wrong, under new business, we could, or if not under new business, under old business, but one place or the other, we could entertain whether we want to schedule an actual agenda item that's properly calendared to take this up. I don't think we could do it. We can't take action at this meeting, but we could take action at the next meeting of deciding what we want to do with this topic. Is that a fair summary?
This is Pat. I think we need the school board presentation as soon as possible. And we also would need to decide on the assembly as soon as we can for like no later than mid-September. This is August. We need to get this in so they can consider it in their budget planning if we decide to make a change.
Pat, I think I'm going to have to rely on Matt on this, but I think the procedural question that I have is whether we can calendar an agenda item for action prior to having a meeting where we can take action to calendar something. I know it sounds like it's circular, but do we need to meet first and decide we want to take the issue up? Or do we, can we calendar it now?
We can decide now whether or not we want to set the public meeting to take the action.
See, I'm not so sure that
It'd be a public hearing. It'd be a public hearing.
That I'm not so. That's my question of whether that what you just said is actually procedurally correct.
Yeah. So this is Matt. Since this is a work session, you are not allowed to take any actions to set it. But this item was on the agenda previously, so I can add it to the next meeting's agenda as unfinished business. And at that meeting, there can be a motion to schedule a public hearing for any changes to the some of the members' benefits. So at the next meeting, there can be public action to schedule it. Just like last meeting, we did public action to schedule a public hearing for the school board's amounts. And also one thing I want to point out is These changes won't go in effect for any of the current assembly members unless they are reelected next year. And so it'd only be
Correct.
two of them. No, yes. So yeah, so it'd be the budget would be staggered as the election years go on.
Okay, so I think another way of characterizing what Matt just said, and we'll extend the meeting just for a few minutes to wrap this up. It's eligible to be talked about at the next meeting in the context of calendaring an action item. And the reason it's eligible is because it's eligible under old business because it was brought up on a prior meeting. Okay. Yes, and Pat, I also heard your concern about getting the other action item calendared, and I think we'll circulate a doodle poll or some kind of questionnaire to find out when everybody can make it and get a quorum. Is there other comments from committee members or questions?
I just want to say thank you to all those who have presented. I'm sorry I wasn't there in person because I would have liked to have seen everyone.
Well, thank you, Pat. We would have liked to see you too. Okay. Well, with that, I think we'll adjourn for the day.